Performing an iris analysis evaluation. When analyzing the iridologist should first ask the person's permission. It is also important for good iridologists to become certified through the International Iridology Practitioners Association, or IPA. Through IPA and through this course, we learn that the highest standards in research in iris analysis are crucial. In order to analyze the iridologist will need a magnifying lens or iris camera. I suggest that the magnifying lens should be at least 10 power and that the camera should be of good quality. If a camera is used, it is good to draw the blinds so that the sunlight will not cast shadows on the eye. Now I'm going to introduce you to a magnifying lens and how to analyze the iris of the eye. The magnifying lens should be about 10 power. So the way we hold the magnifying lens is hold the handle to the side, place your thumb underneath and your forefinger on top. This way you have full control to move the lens around the iris. Do not turn the light on until you have come up to the iris and you're ready to look. So first I'm going to move the magnifying lens in, and we want to have the client look directly at my nose, and that way I get a full view of the eye. As I move in, I'm going to use my middle finger to move the lens in and out for proper focus. When I have the proper focus, I turn the light on. And then I'm able to move it down to the side and back up, and that moves the light around the iris so that we're able to see the various sections of the iris of the eye. And that's the very best way to use a 10 power magnifying lens for iris analysis. In this section, we are going to learn how to analyze a brown, blue, and mixed iris. And now the moment you have been waiting for. We're going to pull everything together that you have just learned and actually work on analyzing some eyes. We're going to analyze a brown iris, a blue iris, and a mixed iris. The first set of eyes is a dark brown iris, which is the hematogenic type. And remember, when you learned hematogenic, you learned that they tend to have difficulties with their blood. They may have thick blood, thin blood, they may have a tendency for anemia and that kind of thing. So remember that an iris evaluation is giving you the questions to ask that person. So I always start with the color. And when I see a brown eye, I ask questions about anemia, questions about if they're tired, questions about have you ever had any problems with your blood or blood circulation. The second thing I would look at here in this particular case is that the entire nutritive zone is very loose and filled with crypts. So the nutritive zone is between the pupil and the collarette, and so we would ask them if they have any problems with their digestion. When we see very loose crypts in the nutritive zone like this, we want to ask them if they have any bloating, any gas, problems with diarrhea or constipation. Whenever we see a very loose nutritive zone, problems with digestion, problems with absorption. And then we want to look at, because problems with digestion can indicate a problem with the liver, and here we see a liver sign, which is called the corneal arcus or lipemic diathesis. And when we see that, we know that there's a tendency not to be processing fats properly. So their digestion is not working like it should. Their liver needs to have some proper nutrition, such as bitter greens. And here we have another sign that the liver is not processing fats properly, which is the pinguecula. So we want to ask about the liver. We see brown pigments out here in the sclera, too far away for a brown eye, so that's showing that the liver is insufficient. We have a crypt here in the gallbladder area, which can show liver insufficiency as well. And in this iris, we have some specific lacuna that we want to look at, that we would ask questions about. And we know that this is a polyglandular eye. They have lacuna around the collarette. And always when I see lacuna around the collarette, I look at the 4 o'clock area, the 8 o'clock area, which has to do with blood sugar imbalance, the 10 o'clock area, and the 2 o'clock area, blood sugar imbalance. So we would ask if they crave sweets, if they have any dizziness, if they don't eat, how important these pancreas areas are. 10 o'clock, 2 o'clock, 4 o'clock, and 8 o'clock. This person has a lot of genetic pancreas insufficiency. Then I would also look here in the area of the ovaries or the testes, and if it's a lady, I would ask if she had any situations at all with her menstruation. Here we see a sign in the uterine area, any cramping or pain with menstruation. And if it's a man, this is the prostate area. We would ask if there's any frequent urination or swelling that they know of in their prostate. And finally here we have some crypts going down into the kidney reaction field. Another question about frequent urination, any aching in the lower back, and problems with their kidneys or their bladder. So this is how I would analyze this eye. We see here at 3 o'clock a lacuna in the heart reaction field. In this case, we want to be very careful not to diagnose when we're analyzing the iris. So here we have a lacuna in the heart reaction field at 3 o'clock in the left iris. We never diagnose and say you have heart problems. What we want to do is ask if they have any family history of heart disorders, or if they possibly have rapid heartbeat at times or poor circulation. We want to ask questions about the heart, but never diagnose when you're doing an iris analysis. When we have a blue iris, we know that they are a lymphatic type right away. So if they're a lymphatic type, we want to ask questions if they have any sinus congestion, lung congestion, or aching joints. That would have to do with how the lymph is functioning in their body. And in this case, this person is also over acid. We can see extra white fibers, a little more white than a regular blue iris. So if they're over acid, we may ask if they have any acid reflux. This person also has a lymphatic rosary going around, and it is especially in the lung area. So we would ask if they have any coughing up mucus, congestion in the lungs. And if they have a lymphatic rosary, they can also have aching in the joints, because we have the rosary going around down here as well. This person has a scurf rim, which is also a subtype of the lymphatic eye. And the scurf rim in the 7th zone means that they have a tendency for skin disorders. So you want to ask if they have any acne, eczema, psoriasis, dry skin, any conditions with their skin at all. So after I look at the main types and subtypes, I then look at the iris structure. What is the structure inside the nutritive zone? So as we look in the nutritive zone, we can actually see the sphincter muscle showing through. And when we see that sphincter muscle in zone 1, we know that their digestion and their absorption is not very good. So we ask them about digestion and absorption. We also see some collarette crypts going around the collarette. And with those types of little crypts inside the collarette, they can have bloating or gas. So we want to talk with them about that. In addition to the digestion and absorption, we see here some brown pigments. Brown pigments anywhere in the iris have to do with liver insufficiency, so we'd ask them how they feel when they are eating fatty foods or fried foods. We have an orange pigment here in the pancreas reaction field, right at 8 o'clock in the left iris. And that orange pigment means pancreas disorders. So we would ask them about blood sugar highs and lows, if they crave sweets, if they feel dizzy at times, if they don't eat. We also have here we have a funnel where the collarette is sweeping out to the iris edge, and it's going actually into the lung reaction field. So there can be some congestion in the lungs there due to toxicity in the bowel. So we want to ask them about how their lungs are functioning, if they're coughing, if they have congestion. We have a lot of tan color here right around the area of the upper collarette, and that can be in the sinus reaction field. So I'd ask them if they have any sinus issues. Also, because it's so white in that area, they may have headaches. I would ask about that. And they have here at 3 o'clock in the left iris a heart lacuna. So I would ask them if they have any heart palpitations or any problems with heart in the family. Now there's something else here that they have, and that is a contraction furrow. So we would want to ask them if they have any anxiety or stress in their lives. There's a contraction furrow there, and there's actually one here as well. So that's how I would analyze this eye. From an overall standpoint, we first look at the color and the subtypes by color, and then we look at the structural areas. I like to start with the structure in the digestive zone, and we look at pigments to see if there's orange indicating pancreas and brown indicating tendencies for liver imbalances. Now we're going to analyze a mixed iris. Remember, the mixed iris is called the biliary eye. The biliary stands for the word bile, which means liver insufficiency in general and digestive problems. So right off the bat, I would ask them if they have any digestive problems or problems absorbing or digesting fats. Then I would look at the subtypes to see if we see any subtypes by color. And I see some of the lymphatic rosary in here, tiny little tophi in this biliary eye. So that would mean questions like, do you have any aching in the joints, any sinus congestion or lung congestion? When there's a lymphatic rosary, there's a tendency also for swelling or aching. I would look then at the structure of this eye, and we see lots of radial furrows coming out from the pupil. And that's a lack of nerve energy up here in the head area. So I would ask them if they have any headaches or sinus congestion, Even feelings of fatigue, lack of nerve energy can cause fatigue. We want to look also at these dark little pigments here. And those little pigments are down in the abdominal region. And because they're so dark, they have to do with liver imbalance. So we would want to ask again about liver insufficiency. We have a perifocal lightening where we have a light cord beside a darker area, and that actually is in the lung reaction field. And we have a lacuna over here in the left iris in the lungs area. So any lung congestion, any problems with the lungs. We have some pancreas lacuna here at 2 o'clock, one at 4 o'clock. So we'd ask about blood sugar insufficiencies here at 10 o'clock, here at 4 o'clock. Do you crave sweets? Do you have any problems with blood sugar? We have several contraction furrows going through this iris. So we'd ask about any anxiety in their lives, any stress. We have a rarefication of fibers down in the kidney reaction field, any problems with frequent urination. And out here in the sclera, we actually have a pinguecula, and that is an additional sign that would show problems with liver, how the liver is processing fats. So overall, these biliary eyes with radial furrows in the digestive tract, and they tend to have liver insufficiencies and digestive disorders overall. But then we look at the specific signs such as the perifocal lightening, the lung lacuna, the pancreas lacuna, and the open lacuna, rarefication of fibers in the kidney reaction field. So when we look at all of these areas, we can know the questions to ask this person and be able to better make suggestions of what they can do in their lifestyle and how they can change their lifestyle and their nutrition.